Hello, this is Dr. Aryan Mowlavi. I am coming to you today from Laguna Beach, California. I wanted to talk to you all about proper facelifts. We're talking about the gold standard in facelifts called the extended SMAS dual plane. I want to teach you all why it is the gold standard, why it's reputable as looking natural and yet being definitive and permanent, and why it is that celebrities ask for the extended SMAS dual plane. So let's get started, you guys. There's facelift outfits everywhere. There's those that promise to do it under local, try to entice you that you don't need general anesthesia. You've heard, I'm sure, about the lunchtime facelift, the mini facelift. There's others that try to convince you to do a neck lift versus a facelift. So today I'm here to teach you all, to keep you out of trouble, and to get you the best results possible. What I want to talk to you about today specifically is why the extended SMAS dual plane facelift and neck lift is the definitive treatment for your face. If you want natural results that are also definitive and permanent, this is the only solution and option for you all out there. So here we go. The first thing that I'd like to discuss with you all is the fact that the face and neck are one fabric. If somebody tries to con you into doing only a neck lift or a facelift, they're pulling your chain, everybody. The face and neck lift are one fabric. They move together. Now, if you need more of a neck pull rather than a face pull, then when we do the face and neck lift, we're going to pull more aggressively with your neck. If you have more going on in your cheek and face than your neck, we're still going to have to do the proper face and neck lift, which is the same procedure, but then we pull more aggressively in the face. That's part one. The second thing I want to talk to you about this premise that the facelift can be done in a mini fashion or lunchtime fashion or be done under local. What I want to get the audience to really appreciate after today's discussion is that a face and neck lift needs to be done in two planes, and that's where the SMAS comes in. The SMAS is a fascial plane that covers the muscles in your face and neck, and it is underneath the skin layer. Now, intuitively, it makes sense that what you see that has fallen, that gravity has taken an effect on, is actually the skin and the underlying fat. That is true. But here's what's not intuitive. If you want a natural result, if you want a beautiful and elegant result that's permanent, you actually don't just pull that layer that's fallen on its own. So, once again, even though it's the skin and the fat that has fallen, what we need to do is not just pull with that layer. We want to divide the tension and leverage into two layers, which includes the skin and includes this layer underneath the skin called the SMAS. It's a fascial muscle lining layer. So here we go. The outfits that promise to do your face and neck lift under a local fashion or in a expedited manner, in fact, are actually doing the skin-only lift. We call it the skin-only lift. And there's flaws associated with that technique that we will cover today. Instead, the more skilled surgeons are going to provide you the opportunity to do a dual plane. Again, what we're talking about is the skin layer, take it up as a separate layer than the muscle lining or fascia layer, referred to as the eponym as SMAS. That's SMAS. So here we go. The skin layer is lifted first. We all do that, even the outfits that do skimpy face and neck lifts. But then the more skilled surgeons are going to go that deeper layer, the SMAS layer, and lift that layer as a second layer. When lifting that second layer, it's not possible to do that under local anymore because the nerves, the sensory nerves of pain, are all densely populating that plane. And if you try to lift that layer without being under, you're going to get into trouble. So what we do as more skilled surgeons is pull that SMAS layer first, and we pull that layer very taut and firm. But that tautness and firmness does not get conveyed to the outside. Instead, then, when we go back and we pull the skin back, we only have to pull the skin to a certain level. In fact, there is a window of opportunity where you can eliminate skin redundancy, yet not over tighten it. Get it? So the SMAS layer goes tight, and that's the underneath layer. And that layer actually hoists up about 60% of the weight of your skin. So when you go back to lay the skin down, you can gently lift it. You don't have to pull it so tight because all the weight is not held on that layer anymore. The underneath layer is doing most of the work for you. So, in a nutshell, I'm talking about doing the gold standard face and neck lift, which is an extended SMAS dual plane, and you get multiple advantages of doing the dual plane. Number one, it's a more definitive pull. You have two handles. If you're going to lift a heavy box or a suitcase, would you rather have one handle or two handles? Intuitively, it makes sense. When you lift something with two handles, you're going to get a better pull. It's going to be leveraged better, and it's going to be more comprehensive and definitive. The second thing I want to talk to you about is this concept of looking natural. Things look unnatural when the skin layer looks deformed or too tight. By virtue of doing a dual plane and taking the tension and putting it on the SMAS layer rather than the skin layer looks natural. It doesn't look tight. It doesn't look overdone. You skip out on what we call the windblown effect, which is this, or the Joker look, which is on your lips like this, and you avoid all of these deformities. In addition, you look natural. In fact, within 1 week to 10 days, we let our patients go out to dinner with family and friends because they look natural. They look great from the get-go. If you have the skin-only lift, you're going to be really distraught for the first 3 to 6 months, and the doctors will tell you, well, just be patient, and it'll get better. And in fact, it does get better. You know, this look where you're pulled tight starts looking better, and you are hopeful. But this leads us to the third issue here at hand, is that even though you look good at 6 months with the skin-only lift, at 1 year, guess what? It all comes back. So this is the concept I teach all my patients, and I want to convey to the audience, is when you have tension on the skin, whether you're getting fat and your belly's pushing on your abdominal skin, or whether you have a tight facelift where the skin feels tight, the skin gets a trigger. It's a trigger induced by pressure or tightness, and it triggers the skin to grow. And once that trigger has been set, it doesn't stop. So the skin-only gals and guys that look overly tight and get hopeful at 6 months, guess what? At 1 year, all that redundancy is back because the trigger for the skin to grow does not stop. So you get this major recoil effect at 1 year, and all your gains are lost. This is in contrast to the dual plane facelift, because that window of opportunity is taken advantage of, where the skin redundancy is removed, but not any more than that is done to the skin, where it's not over tightened. The body never gets the trigger to grow. The skin never grows. So what you see is what you get, and it's permanent, and it's kept for life. Another advantage I wanted to talk to you about is like making a bed. You know how your mom used to make the bed where she pulled the sheets tight, and then the bedspread hugs the sheets and it looks crisp and beautiful? That is in comparison to the skin-only lift, where myself included used to scurry up the sheet and then try to press the bedspread down on that sheet. It never looked proper, never looked smooth. In fact, it looks lumpy and bumpy. Same thing will be seen with the skin-only face and neck lift. It looks uneven, it looks tight, it looks lumpy. This is in contrast to the dual plane SMAS face and neck lift that looks smooth. It looks like the bed that your mom made, because all the underneath layers, including the muscles and nerves and vessels, have been tightened. So when you lay the skin on top of the tightened muscle fascial layer, i.e. the SMAS, the skin looks smooth. It all looks smooth. It is by far the gold standard, and I want everybody to appreciate what I'm talking about. I do encourage you to listen to this video podcast and look at the before and after results that we have using the dual plane SMAS facelift, and convince yourself that a little bit of anesthesia for about 2 hours, 2.5 hours, is worth a lifetime of superior outcomes. There you have it, my dissertation on the dual plane extended SMAS face and neck lift. I want to thank the audience for listening to me. Please send any questions you have to Ask Dr. Mowlavi at cpsi360.com. Thank you.